up everyone, it's Carmen here from drcarmenjames.com, and today I'm coming to you with yet another highly requested video. Today we're going to be talking all about urinary tract infections, or UTIs as they are commonly referred to. And in today's video we are going to be diving into what are UTIs, what causes them, and in particular, what causes you to have multiple UTIs over and over again? What are some of the symptoms of urinary tract infections, and what you can do about urinary tract infections naturally from the comfort of your own home. Now, before we get into this video, I just want to say that this video is not intended to diagnose or treat any medical conditions. It is always advisable, if you have a medical complaint, to go and see your healthcare practitioner. But in this video, I'm going to explain what urinary tract infections are, why they occur, and some of the things that you can try to reduce the symptoms of UTIs from. And so if any of that sounds interesting to you, if you want to learn more about this, if you are perhaps struggling with urinary tract infections that won't seem to go away, and you want to figure out why this is happening to you, then please go ahead and leave me a thumbs up and let's get into this video. Okay, so firstly, what are urinary tract infections? Well, as the name suggests, it is an infection that occurs anywhere along the urinary tract. Now, the urinary tract extends all the way from the urethra, which is where the urine comes out, up all the way into the bladder, and then into the ureters, and then finally into the kidneys. So any infection that occurs anywhere along that tract is referred to as a urinary tract infection, or a UTI. So what causes urinary tract infections? Well, they occur when bacteria that are usually coming from around the anal area make their way into the urethra and then travel along the urinary tract into the bladder usually. And those bacteria settle there, they latch onto the bladder wall, and then they start to replicate or multiply. And that infection that sits inside the urinary bladder is actually what causes the symptoms. So what are the symptoms of a UTI? Well, these can include things like pain. So you may experience lower abdominal pain. In particular, you may experience pain when you are passing urine. Commonly, patients will refer to a burning sensation when they're passing urine. Some patients will say that their urine feels hot, and some people will say that it's actually painful and they experience discomfort on passing urine. The other thing is that you may experience what's called frequency. Now, frequency is where you go to the toilet more frequently than usual. And oftentimes you get the sense or the feeling like you haven't quite emptied your bladder completely, what we refer to as incomplete voiding. And so the other thing that may happen is that you may experience passing lots of urine at night. That's called nocturia. Another symptom that you may experience is something called urgency, which is basically when you need to go to the toilet, you need to go now. Like you feel like if you don't get to a bathroom immediately, you are going to soil yourself. Right? Some other symptoms of urinary tract infections can include lower back pain. Some people may experience fever. If you manage to look at your urine, you may notice that it has changed color. In some instances, the urine may appear cloudy, or it may even appear pink or red if you are having a severe urinary tract infection and experiencing blood in your urine. Okay, so like I mentioned earlier, UTIs are caused by bacteria that are commonly coming from around the anal area, going up into the urethra, which is where the urine comes out. Now, women generally tend to be a lot more prone to UTIs for a few reasons, and I'm going to show you on the model just to try and demonstrate and explain why that is the case. So if you have a look at this model, it's showing you typical female genitalia here. And so in the back here, you've got the rectum coming out into the anus. Here you've got the vaginal canal, and this is the uterus. And then here you've got the urethra, which is where the urine comes out, going into the bladder. Now, generally, as I said, women are far more at risk for getting UTIs, and part of the reason for that is the proximity of the anal area to the urethra. They're kind of on the same plane, and so it's far easier for bacteria to kind of be present on the surface here on the skin, and then eventually track up and get into the urethra, causing an infection in the urinary tract. The other thing is that it's very common for women to get this infection after intercourse. The reason for that is because the friction that occurs during intercourse makes it easier for bugs that could have been sitting around the anal area to then migrate up into and around the urethra, going into the urinary tract and causing an infection. And so those are some of the reasons why it's more common for women to get urinary tract infections. Some of the other things that could cause UTIs is using products, for example, sanitary products that are fragranced and scented, that may cause an irritation, that may allow for the overgrowth of certain bacteria to occur as well. The other reason why it may be more common for women to get urinary tract infections than it is for men to get them is because after you've been to the restroom to relieve yourself, some women wipe from the back to the front. And so you can see by this model that if you do that, you are taking the bacteria that may be sitting around the anal area and transferring it up into close proximity with the urethra. So it's very important to keep that in mind. The other common reason why you may develop recurrent UTIs is if you're not drinking enough water. Remember that when you are drinking water, you're going to go to the toilet to pass urine more frequently. And that action of passing urine is going to ensure that any bugs or bacteria that may be sitting inside the bladder, getting an opportunity to multiply and establish themselves and cause an infection. If you are drinking enough water, you're going to be passing more urine, which means that you're going to be urinating the infection out every time you pass urine. It's also very common for women because oftentimes we are very fussy about the toilets that we use. We worry about how clean they are, if there's any toilet paper available. It's like a whole mission if you want to go to the toilet generally. And so oftentimes we hold our urine in, and this can put us at higher risk of getting UTIs. I would often have patients who would tell me that they deliberately don't drink enough water, especially while they're at work, for example, so that they don't get up and go to the toilet all the time. And this is very typical for the reason why people can be more prone to developing UTIs. Now, in particular for people who experience recurrent or ongoing urinary tract infections, one of the other things that you may need to consider is, do you have an underlying medical condition that is causing your immune system to be suppressed? Oftentimes people, for example, who have diabetes or people who are on immune suppressant medication, in other words, medication that is designed to suppress the immune system, can be more prone to infections. The other thing is that bacteria love sugar. And so if you are diabetic, then ultimately you are going to end up with sugar in your urine, which is going to put you at higher risk for developing urinary tract infections. Okay, so now moving on to some tips that you can try to prevent urinary tract infections from recurring, and also some of the things that you can try if you have a UTI and you want to know how to alleviate some of those symptoms and get rid of the infection naturally without needing to take antibiotics. So I have to say again that it's important, if you are experiencing symptoms of a urinary tract infection, that you go and consult your doctor. It's important that if you have an infection that does require antibiotics, that you need to be taking those antibiotics. But if you've experienced recurrent UTIs and they're happening to you over and over and over again, and you've been on multiple courses of antibiotics, then you may be getting frustrated about having these recurrent infections, and you may be looking for something as an alternative to do, or you may even be looking for something to support you as a natural supplement as you are healing from a urinary tract infection. So let's dive into some of the things that you can do to prevent and to manage the symptoms of UTIs naturally. So the first thing that I can tell you to do is drink more water. As we were talking about just now, if you are not drinking enough water, that flushing action of getting those bacteria that are causing the infection out of your bladder is really what you need to be focusing on. So drinking and making sure that you're staying hydrated and drinking enough water so that you're continuously flushing that infection out is definitely going to help to reduce the symptoms. Now, it may seem counterintuitive because if you have a UTI, you are probably going to the toilet to pass urine very frequently already. So drinking more water may seem like this is going to make the situation worse. But really, it's important to dilute the urine that's already inside your bladder and make sure that you are passing urine frequently in order to promote flushing that infection out. Another thing that you must remember if you want to prevent UTIs is to make sure that whenever you need to go to the loo, that you go to the loo. It's important that you don't hold your urine in, because again, that stagnant urine sitting inside your bladder is the perfect opportunity for bacteria to overgrow. So you want to make sure that you are relieving your bladder frequently whenever you feel the urge to do so. Something else that may help to prevent UTIs is to make sure that you are wiping after you've relieved yourself in the restroom, that you are wiping from the front to the back and not from the back to the front. This is probably one of the most common things that I find as a trigger or a cause of urinary tract infections. And so just as a reminder, it's important when you are done, whether you are using the toilet for number 1 or number 2, that you make sure that you are wiping from the front to the back. And this is very important to teach little girls as well, because it's very common for little girls to get UTIs. Again, because of the fact that anatomically, based on the anatomy, the urethra and the anal area are so close together. And so it's important to start them young and get yourself and your little girls into the habit of wiping from the front to the back. Another thing that you may not think is associated with UTIs is what you are eating. So as I said, it's very common for the bacteria, usually it's E. coli, that comes from the anal area to get up into the urethra to cause the infection. And so if you are making sure that you are eating a diet that is filled with fresh fruits, vegetables, whole grains, fiber, and you make sure that you are having a higher population of good bacteria than bad bacteria in your gut, it's going to reduce your incidence of having recurrent UTIs, because those bacteria that are pathogenic, that actually cause disease, are not going to be there in the first place. So paying attention to your diet is super important. Make sure you are eating a highly nutritious diet and that you are loading up on fresh fruit, vegetables, whole grains, and limiting the amount of processed foods. This is important to make sure that the bugs that ultimately end up around the perianal area are actually not going to put you at risk for getting an infection. Another way to prevent UTIs is by ensuring that you are taking in probiotics. Now, you can do this by taking in probiotic foods like sauerkraut or kimchi or kombucha or kefir, or you can take a probiotic supplement. So I would advise, if you are experiencing recurrent UTIs, that you get on a good probiotic. And the reason for that is because, as we mentioned, it's important to make sure that the bacteria in your gut are healthy, and a good way to make sure that you are supplementing those bacteria is by taking a probiotic every day. But another reason why you may consider taking a probiotic is if you wanted to treat a urinary tract infection naturally. This concept is known as crowding out. So the concept of crowding out basically means that when bad bacteria are in excess, they are going to cause infection. But if you've got good bacteria, and if you start to supplement with good bacteria in the form of probiotics, for example, you are going to increase the amount and the diversity of the good bugs that are eventually going to crowd out the bad bugs and thereby reducing the infection. So it is a great idea, if you are experiencing symptoms of a urinary tract infection, that you take probiotics to help to crowd out those bacteria that are causing the infection. So you could also use an intimate wash that has probiotics in it. Remember that intimate washes and soaps that are used in the genital area are actually going to strip away and remove all bacteria. So you don't want to use any soaps or any harsh chemicals in that area. But if you manage to find an intimate wash that contains probiotics, then that will be super beneficial to also help this concept of crowding out the bad bugs so that the good bugs can take care of the infection. So another supplement that you may consider adding if you have symptoms of UTI is a cranberry supplement. Now, it's very common to see people writing all over the internet that if you have a UTI that you should be having cranberry juice. And I just want to say that the cranberry juice that you find in the store, like that fruit juice, is not what we're talking about here. Cranberries have something called PACs in them that help to reduce the bacteria's ability to latch onto the bladder wall and establish themselves and cause infection. But you really need either the whole cranberries or you need the cranberry concentrate. So the actual cranberry juice, right? Without any added sugar. Because remember that we said that any sugar that you take in is going to feed bacteria. So the reason why that cranberry juice is not good enough is because of the fact that it's high in sugar, but also because it's low in the active ingredient, which is what we want from the cranberries. So you could either go and get some cranberries and make a cranberry smoothie. They are very tart and sour, so you may or may not be able to tolerate them. But you could also get cranberry concentrate, which is the juiced concentrated form of cranberries. You could take that as a supplement. Alternatively, you can get cranberry capsules. And so this is a great way to get in those important nutrients and supplements that the cranberries offer to help to naturally reduce the symptoms of UTIs by eliminating the bacteria's ability to establish an infection inside the bladder. And it's important to drink water. Did I mention that? I think it's important to mention it again. If you have a UTI, please drink lots of water. Another thing is to make sure that you pass urine after you have been sexually intimate. So this is going to help to flush away any bacteria that could have moved from around the anal area up near the urethral area. So I have got a few more tips for you, but if you are enjoying this video so far, please go ahead and like it. And if you haven't already, please subscribe and hit the bell so that you get notified anytime I post a new video. I'm also keen to hear from you what other videos you would like to see on this channel, and if you have any questions, please leave them in the comments section below. So a few more tips that you can try if you have a UTI and you want to get rid of the symptoms and get rid of the infection without necessarily taking any antibiotics. Now remember, antibiotics are important to kill bad bacteria, but unfortunately they also eliminate the good bacteria, and sometimes they can put you at risk for ongoing or recurrent infections. So while sometimes antibiotics are absolutely necessary, it's oftentimes more important to try and prevent the infection and even try and treat it naturally before you opt for the antibiotic option. Something that you can do to relieve the pain is use a hot compress. So either you could use a hot water bottle or one of those wheat bags. That will help to relieve some of the pain or discomfort that you're experiencing with the urine tract infection. Sometimes using a castor oil pack can be helpful as well. Some people also say that drinking apple cider vinegar helps to reduce the symptoms of UTI. It's still unclear about how this happens, but lots of people who experience recurrent UTIs use apple cider vinegar and they report that they experience relief of their symptoms. So my advice is to dilute the apple cider vinegar, so 2 tablespoons of apple cider vinegar in 500 ml of water. And then finally, I would like to suggest that you try a vitamin C supplement if you are experiencing symptoms of UTI. Vitamin C can be important to help support your immune system, so that will help you to fight infections. And vitamin C has also been shown in some studies to help to kill the bacteria that are responsible for the infection in the first place. And so I hope that you enjoy these tips. I hope that if you are experiencing the discomfort of chronic or ongoing UTIs, or if you're experiencing a UTI for the very first time and you don't know what to do about it, I hope that these tips help you. If they do, please go ahead and let me know in the comment section below. And until next time, take care of yourselves. Bye.